Good morning, student. So today we will discuss about the acute kidney injury. Okay, this class is for the 9th semester MBBS student. Okay. Acute kidney injury. In today's lecture, what we are going to discuss? We are going to discuss about the definition of acute kidney injury, and then we will also discuss about the first we will discuss about the definition. Okay. Second is we will discuss about the criteria to diagnose the acute kidney injury. Third one is we will discuss about the type of AKI, and we will also discuss about the etiology in the subheading. Then we will discuss about the clinical feature of AKI, acute kidney injury. Then also complication. Then we will also discuss about the investigation and the treatment of AKI, acute kidney injury. So probably you know acute kidney injury is one of the important cause of the mortality worldwide, and near about 10% of the patient with AKI converted to the chronic kidney disease. That is why we have to know about the acute kidney injury. There is no shortcut for that. Okay. So then what is the definition of AKI? So first of all, before going to the definition, why it is called acute, why it is called kidney, and why it is called injury. Previously the term acute renal failure was used. Acute renal failure was used, but now it is acute kidney injury. So renal is difficult to understand for the common people. That is why the terminology has been changed to the kidney. So it is easy, even the common people can understand what is kidney. And why it is changed from failure to injury? Because failure means, oh, people understand that we cannot salvage the kidney, but actually that is not true. We can salvage the kidney with our prompt action. That is why the terminology has been changed to the injury. Injury means it is just an injury. If you take a proper action, then we can prevent the kidney. That is why the terminology is called acute kidney injury. Acute means there is the abrupt deterioration in kidney function. That is why it is called acute. And there is also a term called chronic kidney disease, and the time limit to differentiate acute kidney injury from CKD is 3 months. If someone has the kidney function impairment for more than 3 months, then we call that the CKD. Okay, if it is less than 3 months, then we call it acute kidney injury. Oh, then how we can define the acute kidney injury? So is the abrupt onset of impairment in kidney function is called the abrupt acute kidney injury. So to define acute kidney injury, we have a criteria. We have a criteria, that is, if someone has the increase in creatinine value by 0.3 mg of increase in serum creatinine within 48 hours, then that is called the acute kidney injury. within 48 hours, more than 0.3, and the serum creatinine. So that is the acute kidney injury. So if someone has the creatinine level of 1.2 today 6 am, and if on repeating the creatinine, if it is more, it is 1.5 in 6 am tomorrow, so there is change of 0.4 within the gap of 24 hours. So that it is the acute kidney injury. It is the acute kidney injury. Okay. So this is not the only one definition of acute kidney injury. This is not the only definition of acute kidney injury. Okay. So another definition of acute kidney injury is if someone has the deterioration of EGFR by more than 50% in 7 days or 1 week, then it is also the AKI. Let us suppose Mr. Ram has the EGFR of 60 today and it is 25 after 5 days, then it is also called the AKI. So this is another criteria to define the acute kidney injury. The third criteria to define the acute kidney injury is that if someone has the urine output less than 0.5 ml per kg per hour for more than 6 hours, then it is also the AKI. Okay. Suppose 50 kilo person, if the 50 kilo person for 6 hours, 50 into 6 into 0.5, near 150 ml urine. If the 50 kilo person have less than 150 ml of urine in 6 hours, then that is also the AKI. So to summarize the acute kidney injury, we have three defining criteria for the AKI. We have the three defining criteria for the AKI. Okay. So three defining criteria for the AKI. What are these? One is increase in serum creatinine by more than 0.3 in 48 hours. Okay, in 48 hours. Second is decrease in EGFR by more than 50% in 7 days. Third one is urine output value less than 0.5 ml per kg per hour for 6 hours. So these are the three criteria to define the acute kidney injury. Okay. Then can you grade the acute kidney injury? Yes, you can grade the acute kidney injury, but let us not make the things complicated. Okay, I will directly go to the type of the AKI for the 9th semester MBBS student. Kidney, we have already discussed in the kidney. These are the there are the efferent and arterioles. These are the tuft of the capillaries, which we call the glomerulus, and here is Bowman's capsule here. Bowman's capsule here is PCT, then here is loop of Henle, then is collecting duct, and ultimately then it will drain and like. So the acute kidney injury is of three types. If the injury occurs prior to the kidney, then that is called the pre-renal acute kidney injury. If the injury occurs in the kidney, that is called the intrinsic acute kidney injury or renal kidney injury. If the injury occurs after the kidney, that is in the ureter or in the bladder, if there is obstruction, then that is called the post-renal acute kidney injury. So there are three types of the acute kidney injury. One is the pre-renal type, one is the pre-renal type, pre-renal, another one is renal, and third one is the post-renal, post-renal. So, in the pre-renal type, especially if there is an excessive amount of the volume loss from our body, like if someone is having the excessive vomiting or diarrhea, one, or if the blood is not coming to the kidney because of the condition called shock. In the shock, our body tries to maintain the circulation of the brain and the heart. So, the blood divert from the kidney to the heart and the brain, and your kidney is not going to get the sufficient amount of the blood. In that scenario, you can have the pre-renal AKI. So, some of the cause of the pre-renal AKI is like vomiting, diarrhea, and in the shock state, or sometime in case of the shock, especially shock, different types of shock. Though shock can cause even the renal kidney injury. And in case of renal injury can occur in three parts. One is injury can occur in glomerulus. Second one is injury can occur in tubulointerstitium, and third can occur in the vessel level, vascular level. So, common cause of glomerular injury as the glomerulonephritis, and you know about the glomerulonephritis, we will also discuss that thing later on. Second is the tubulointerstitial disease. Tubulointerstitial disease can be caused by the different immune mediated process, different toxins, different organism. It can cause the tubulointerstitial disease, and there can occur the different vascular injury because of different vasculitis in the kidney. So, these are the cause for the renal AKI, and the last one is the post-renal AKI, especially in case of the obstruction caused by the bilateral ureteric stone or the obstruction at the level of the bladder, like in case of the big prostate, or obstructing the bladder neck by the stones. If there is obstruction in the drainage system, then that cause the post-renal acute kidney injury. So, there are three types of the AKI, and we have also discussed about the causes of the AKI. Actually, we can differentiate the pre-renal AKI from the renal AKI. Renal AKI, there are some parameter, but let us discuss just the basic of the AKI. If you get an idea regarding the basic information of the AKI, then we can discuss that thing later on as well. Then we will discuss about the clinical AKI. So, AKI, what are the clinical picture? AKI, when you have to suspect the AKI, so like in case of the pre-renal AKI, the history will be like the risk factor will be the vomiting or diarrhea, like that will be the risk factor. And historically this type of patient will have the oliguria, because like there is no enough amount of the blood to form the urine. All the glomerulus filtrate will get reabsorbed in the circulation. So, if someone has excessive diarrhea, someone has excessive vomiting and the oliguria or anuria, then you have to suspect the pre-renal AKI. In case of renal AKI, other than like some patient may have the oliguria, some patient may have the polyuria. Other than that thing, they can have the history suggesting of the glomerulonephritis, like some patient may have hematuria, okay, some patient may have the kidney renal pain, in the flank pain, like that. In case of post-renal AKI, definitely they will have the feature of the obstruction, like like they may have the feature of the clinical feature of the benign prostatic hyperplasia. As such, these are the some subtle clues to suggest the AKI. So that's why we have to suspect AKI in such scenario. Okay. Then what are the complications of AKI? For to understand that thing, what are the things like what are the functions of the kidney? So one of the important functions of kidney is the fluid management. Yes. So definitely patient with AKI can have the excessive fluid overload if they have the especially renal acute kidney injury. In case of prerenal AKI, they may be the hypovolemia, but one of the complications, once they develop the acute kidney injury, they can develop the fluid overload presenting with the feature of pulmonary edema, and sometimes they may have the swelling as well. Second, other functions of the kidney is electrolyte management like especially the potassium. So one of the function of the kidney is to excrete the potassium. So if the kidney function is impaired, then definitely they can have the hyperkalemia, and you know, if there is a severe hyperkalemia, then even that can kill you. So one of the important complication is the hyperkalemia, and that we have to always see the potassium level in a patient with acute kidney injury. Third one is definitely the hydrogen ion excretion. So kidney also excrete the hydrogen ion. If the kidney function is impaired, then they can develop the metabolic acidosis. They can develop the metabolic acidosis. Okay. So these are the common complications of the acute kidney injury. There are other complications, like some patient may have the like the problem in the like uric acid, that they can have elevated uric acid level. They can have the elevated uric acid level. And one important complications that we have to always discuss is urea, because as in a patient with acute kidney injury, there can be the accumulation of the urea, and as you know, urea can cause so many things in our body, like the patient can present with uremic encephalopathy, uremic pericarditis, or uremic gastritis. So one of the important complications of AKI that we see is the uremia. So in the day-to-day clinical practice, the common complication of the AKI is one is related with the volume overload, especially pulmonary edema. Second one is hyperkalemia. Third one is metabolic acidosis. Usually most of the patients develop the metabolic acidosis, and they may have the feature of the uremia. These are the common complications of the AKI. These are the common complications of the AKI. Okay, AKI. Okay, then how to investigate the such patient? How to investigate such patient? What are the tests you want to do? So definitely, so to manage the patient of AKI, other than the investigation, one important thing that you need to monitor is urinary output. Okay, daily urinary output is important. So test you can do like renal urea and creatinine, where most of the time it is elevated. You can do electrolytes test, like electrolytes like you can do sodium, you can do potassium, and you can, these are the tests basically. Okay, these are the tests you have to do. Third one is definitely you want to do the if it is required, then you have to do urine REM, because it can give us a clue to different glomerulonephritis or tubular interstitial disease or rapidly progressive glomerulonephritis in the urine REM. Definitely you can do the USG abdomen to see the kidney size or because if the kidney size is already sunken, then it suggests the CKD. So you can check the kidney size, corticomedullary differentiation. These are the things you can check. Another thing that is going to help by the ultrasound abdomen is obstruction. If someone has the like post-renal AKI because of the big prostate or bilateral ureteric stones, that can be the clue can be you can get that clue from the ultrasound abdomen. Okay, you can. So other than this, one important test all you have to always do is the ABG, because arterial blood gas analysis, because as I have already told that you can see the metabolic acidosis in a patient with the AKI. So other tests you can do the ECG to see the any changes related to the potassium. You can see the X-ray to see any changes related to the volume overload. These are the things you can do, definitely, yes. And definitely if someone has the unexplained AKI, then definitely you need to work out for the different autoimmune disease like SLE or different vasculitis like small vessel vasculitis. You have to work out for the small vessel vasculitis. These are the things we have to see. Okay. Yes, and there are some novel biomarkers which can detect the AKI prior to the rising urea and creatinine, because when the urea and creatinine is raised, then it is already the kidney is severely impaired. So, we can detect the AKI in initial stage by doing the novel biomarkers like kidney injury molecules like KIM. Okay, these are the novel biomarkers, but for the MBBS level, just remember these things. Okay. So, how we are going to treat the AKI? So, treating the AKI in a book is quite complicated, but I'll try to make it easy because I have been associated with one of the project called 0/25 project. In that project, we have we have a protocol, SOAP protocol. Okay. Second one is the fluid therapy protocol. Okay, and third one is sepsis protocol. Sepsis protocol. Sepsis protocol. So, what you do in the management part, when you see the patient of AKI, just you first do the screen for sepsis. S means screen for sepsis, because we have to always screen for sepsis, because sepsis is one of the important cause of the AKI. Okay, it's like sepsis is one important cause of the AKI. So, you have to always screen for sepsis, and if there is AKI, we have to manage the sepsis. Okay, that is why you have to always screen for sepsis. You have to, second is optimize the hemodynamics. Optimize hemodynamics. Optimize hemodynamics means some patient may have low blood pressure. Some patient may have the low blood pressure. Like in that we have to give the fluid, and you have to use the ionotropes for that condition. Some patient may have the high blood pressure like malignant hypertension, which can present with AKI. In that scenario, you have to use the antihypertensive. So, you have to always try to optimize the hemodynamics and always try to maintain the blood pressure. And third one is the avoidance of the toxins. The avoidance of toxins means toxins use is one of the important cause of the AKI. Like classical toxins that can cause AKI is antibiotic like NSAID or enalapril, or there are different Ayurvedic medications, different antibiotics that can cause AKI. Even the diuretics sometimes cause AKI. So, these are the toxins that we need to avoid, and only by avoiding them we can prevent the further acute kidney injuries. Okay. And last P means is the prevent harm. Prevent harm means sometimes prevent harm. Sometimes we need to work up for other autoimmune disease and give the, like if you diagnose the autoimmune conditions called SLE, then in that scenario we have to use the steroid or immunosuppressives. That's how we can prevent the further harm. And there is prevent harm means like if someone may need the dialysis, because if someone has a severe metabolic acidosis, medically refractory hyperkalemia, fluid overload because of pulmonary edema, then such patient may require the hemodialysis, and you have to plan accordingly. That comes under the subheadings of prevent harm. In case of the fluid, so SOAP means screen for sepsis, O means optimize hemodynamics, A means avoidance of the toxins, avoidance of toxin, and P means prevent harm. In case of fluid therapy protocol, if patient is hypovolemia, then we have to give the adequate amount of fluid. If patient is hypervolemia, then we have to use the diuretics. That comes in the fluid therapy protocol, and we have to assess accordingly. In case of the sepsis protocol, if patient is in sepsis, then definitely we have to use the sepsis protocol, like starting the broad spectrum antibiotics within 1 hour. That is called by sepsis protocol, and like maintaining the blood pressure. There are other things in the sepsis protocol as well, but definitely we have to manage the sepsis protocol. So if you get any case of the AKI, then we have to always think about the pre-renal AKI or renal AKI and the post-renal AKI. We have to investigate them, and we have to manage them with the SOAP protocol, fluid therapy protocol, and the sepsis protocol. If you do the AKI management with this protocol, then we may save the lives of so many patients with AKI, and can also prevent the development of the chronic kidney disease. So, if you have any comments, then you can write in the comment section. I am happy to answer. Thank you so much for your attention.